Okay, I think we're good now. So I'd like to, this is Chris Kelley from the National Institute for Biomedical Imaging and Bioengineering, and would like to welcome you all to the Pediatric Research Using Integrated Sensor Monitoring Systems program webinar. And our acronym for the program is PRISMS. There are a number of people in the room today, and I didn't actually get everybody on the slide, so we'll go around. We have people from program, people from review, and people from grants management. So we'll go around and introduce ourselves, and then I'm going to give it just a short summary of what the PRISMS program is, and then we can open it up to questions from all of you. So as I said, I'm Chris Kelley from the NIBIB.
Hi, my name is Tiffany Bailey-Lash. I serve as the program contact for the PRISMS Sensor Development Project for Asthma, the UO1. I'm a program director for the Micro and Nano Systems program here at NIBIB, as well as the Sensors program.
Hi, I'm James Huff. I'm from the Office of Grants Management on the Financial and Grants Management point of contact.
Todd Merchak with the NIBIBM in our Office of Program Evaluation and Strategic Partnerships.
Good afternoon or good morning. I'm Tom Peterson, Chief of the Bioengineering Sciences and Technology Section, which is going to be handling the UO1 and the U24 scientific peer review case.
Hi, I'm Vinay Pai. I'm the program point of contact for the Data and Software Coordination and Integration Center, the U24 mechanism.
And Bill Heat-Dirks from NIBIB, and I'm the program contact for the platform, the U54 mechanism, although it says U45 on the slide.
Oh, sorry.
Mark Ferrer from CSR, and I'm the review officer for the U24.
Hi, I'm Kee Kellen. I'm a review officer at CSR, and I'll be the review for the UO1.
Okay, that's right there.
I'm Peter Kozel. I'm a scientific review officer in the healthcare delivery methodology. I'm one of the SROs who will be managing the review of U24.
So that's all of us here in the room. Could everyone hear everybody? Of course, you're muted, so if you can't hear, unmute and say can't hear. Okay, great. Sounds like everybody can hear. Is there anybody on the phone on the webinar outside of the conference room from NIH who is involved in the development of the initiatives? Many of the other institutes? Okay. All right. So for an overview of the PRISMS program, so we were lucky enough to get money from the National Children's Study that was discontinued this year, and so that the funds were redirected into new studies for pediatrics, and so it was a very tight time frame that we had to work within because everything has to be funded within fiscal year 2015. So in April, we released the three PRISMS RFAs. In June 1, your applications are due. September 18th, they will go to the NIBIB Advisory Council meeting, and then all funding for all 4 years of the program will be done in FY15, so before the end of September. And the goal of the whole program is really to develop a non-invasive health monitoring system for pediatric asthma research. And there are 3 initiatives. There's the Sensor Development Projects for Asthma, which is RFA 15002, which uses the UO1 mechanism. The second initiative is Informatics Platform Technology Centers, which is RFA 15003, and it uses a U54 mechanism, not a U45. And the third is the Data and Software Coordination and Integration Center, which is RFA 15004 and uses the U24 mechanism. So I'll just briefly go through the objectives of the 3 separate RFAs, which together are going to form the PRISMS program. So the sensor development projects for asthma are looking for wearable and stationary sensors that can monitor pediatric environmental exposures, physiological signals, activity, and or behavior in a natural environment, all to gain insights into environmental determinants of asthma. And the sensors can be in the development stage, or they can be existing sensors that you are proposing to redesign to fit the goals of the PRISMS program. And they will, all of the sensors will need to be able to plug and play either physically or wirelessly with the informatics platforms that will be developed and funded under RFA 15003. So RFA 15003, the informatics platform technology centers. These centers will design informatics platforms for acquisition of data from the environmental, physiological, and behavioral sensors that are being developed in the RFA that I just described, and the platforms will need to have the capability for data integration, processing, visualization, and securely uploading of results to a data and software coordination and integration center that will be funded under the 3rd RFA, which is RFA 15004. And this is a description of that, the Data and Safety Coordination and Integration Center, or easier to say DSCIC. So the DSCICs will coordinate and integrate data acquired by the informatics platforms. They'll ensure consistent annotation of the data and tools generated within the PRISMS program. They will incorporate relevant non-PRISMS data into the PRISMS resource, support integration of relevant data and tools to allow for seamless exploration of the PRISMS program output by a broad range of biomedical researchers, support linkages to outside knowledge bases, data portals, and resources, support training in integrated sensor monitoring, data science skills, build innovative access and query tools to disparate databases hosting multiple data types, and disseminate and the resulting tools and resources to a broad range of biomedical researchers. So together, those 3 initiatives make up the PRISMS program. The central mission of the PRISMS program, as I said before, is to develop sensor-based integrated health monitoring systems to serve as research tools to measure environmental, physiological, and behavioral factors in epidemiological studies of asthma in the pediatric population. And our intention is, and the reason for doing a cooperative agreement is that the investigators funded under the 3 arms or RFAs of the PRISMS program will work very closely together to ensure functionality of the overall system. So they're pieces of the system that will be, there'll be parts put into an entire system. And I think with that, we can entertain questions. It's hard to I guess, if 2 people speak up at the same time, one person can sort of step back and their question can come next so that there's not a lot of people asking questions at once.
Could you please clarify a little the informatics and the data part, because some virtual sensors that is bringing together multiple data types with the physical sensors that might be being worn.
Repeat the question. Could you repeat the question?
Yeah, you're not coming in clearly, sorry.
I put it in the chat window if you saw. Could you please clarify the distinction between the data back end and the informatics platform, because there could be some overlap between the two. For example, you could imagine some virtual sensors which are using contextual information in conjunction with the wearable sensors, and they could easily, it seems, fit into either call.
So I'll start that, and again, I think to stress what Dr. Kelley mentioned, that these are going to be cooperative agreements, and it really is one program with these three arms. That those partitions, as you point out, are in some ways arbitrary, but it made sense at the time. Conceptually, the platform, the major pieces of the platform are really the software components associated with what's probably going to be a smartphone. So it's the software components associated with the interfaces with the sensor devices, software components associated with the interface to the user, and software components associated with communicating to the data center. But I think, you know, the exact way this partitions is not going to be exactly worked out until we work it out. I think the one other piece for the informatics platform is to provide, you know, position and timestamps to all of this data, so that all data automatically time-stamped, person-stamped, and location-stamped. And
yeah, so if I can add to that, one way to look at it is like you could have several different platform developers. One could be developing for the Apple platform, one could be for the Samsung platform, and so the data coordination center will be the one taking all that data from different diverse sources together and combining all of that together. You could also have data collected from platforms which are working with separate populations, and so how do we coordinate all that? And that's what the DSCIC's role is also going to be. I hope that clarifies.
So on the cell phone part, how about IoT devices, say, that are streaming air quality but aren't connected to the cell phone Wi-Fi or?
So if they're not connected in that way, so the data flow from the data center, and again, I think some of these kinds of details are going to evolve as we work this out. But I think the answer to your question is that data flow from the data center could go to the device. There could be bidirectional data on both cases, and so that the algorithms that are being used to present information to the user could make use of sensors that are feeding right into the smartphone, but they could also be making use of central information that would be coming from the data sensor, if that answers it.
So you have to use the cell phone's own Wi-Fi connect directly, not using the cell phone.
Yeah, so that would be considered like a different platform, right? I mean, so these could be sensors which are standalone sensors not connected to a cell phone, but you could have a collection of sensors working together to provide information about a certain geographic point or location. And those could go through the platform, and they could be combined with other sensor data sets and then moved forward to the data coordination center.
Right, so that's okay.
Yeah, I think that's okay.
Okay, great. Thank you.
Next question?
I had a quick question.
Go right ahead.
So you mentioned the first RFA is sensors, and you also mentioned algorithms. So we're particularly good at gathering data, and we're also good at running algorithms to kind of analyze it and predict risk on certain factors. Where would the algorithmic side of this fall under? So let's say you're gathering breathing signals from a patient out in walking around. Where would the algorithms for kind of analyzing that breathing fall under? Under which of the three?
So are these algorithms for one sensor, or are they algorithms for integrating data?
Particularly for one sensor. So we're interested in looking at breathing and how you can kind of extract sort of the severity of asthma by looking at their breathing.
Yeah, offhand, I would say that would fall with the sensor if it's
okay.
One thing you're measuring.
Okay. All right. That's what we're planning. Okay. Thank you.
Other questions? Don't be shy.
So I had another question. What do you think about virtual sensors, also in the sense of so many times the socioeconomic status can have a bearing on how likely someone is to get asthma. So, for example, on a census tract level, you can have relevant information from the regular census information. So one might want to have bring in that information, which you could view as a virtual sensor for that location. How do you view that type of information? Sorry?
What was the final question?
So the concept of virtual sensors, which is really, say, contextual information for a given locale that is not coming from a physical sensor.
Right. So if it is coming from, let's say, some physical sensors or cameras or what have you, traffic cameras or something like that, that would not integrate with the platform, presumably if that kind of information was being made available, it would have to come through the
coordinating center.
Through the coordinating center.
I don't understand.
Hi. I have a question.
Yes.
So the question is, we're looking at the different asthma triggers identification. So how granular or how fine should be the identification of, say, the triggers? Say, should we looking at, say, just plain mold spores or pollen, or we should be trying to identify different pollen subspecies?
Identifying the subspecies is encouraged.
That's actually what we planned, but I'm just asking. And the second question is basically, how about the possible physiological triggers? Say, how about detection of things like hypocapnia and similar?
That's applicable as well.
Okay. So basically, if this is a comprehensive system that can measure both these and convert that into something that's transferable by the cell phone, this will fit into the
yes,
program.
It will.
Okay. That's the question. Thank you.
So that's fine, I think.
I can't see them. Oh, here, I got them here. Okay, so there are some questions under the chat on the WebEx. I think we answered the first one. Oh, some people are still muted? Oh, okay, so hopefully everybody's unmuted now. I have a collaboration with Samsung Electronics Smartphone Group. Can I collaborate with Samsung for responding for this RFA? Yes, The answer is yes, of course. On open sourcing code and data, is sharing only through the DSCIC, or are we encouraged to share with communities as on GitHub and equivalent?
Yes, we encourage sharing wherever you can share.
Is there any commercialization aspect to this program? I would say no. What we're trying to do right now is just get a tool that can be used for epidemiological studies. I'm trying to ask a question, but you can't hear me. Can you unmute Helen Ray? We're trying to unmute you, Helen. Hmm? Okay, Helen. Yes. Do you think everyone's having that problem that we mentioned?
Well, we're unmuting. One of the previous questions relating to GitHub was, can you share data and code on GitHub? And the code, I think, yes. The point is made, though, that the sharing data would not be done because there are going to be major privacy issues here, so that the data itself would not be shared there.
Helen, are you unmuted? Oh, is that her?
Yeah, but she's not muted.
Oh, Helen, you should not be muted. You are not muted, if you're still there.
She can submit her question in the chat.
Or submit your question via the chat button.
Here we go.
One question.
Everybody's question is about muting. Okay, here's one. The sensors RFA mentioned 3 types of sensors: exposure, physiological, and behavioral. Do you expect one proposal to address all the 3? The answer is no. I mean, if you have an array of sensors that could cover all 3 of those, that would be great. But no, we were envisioning probably most people would have, either a physiological sensor or a environmental sensor or behavioral sensor, and because we're going to fund several projects, they would together make an array of sensors that could measure environment, physiology, and behavior. So if you just have environmental sensor, then that's fine, or just physiological, fine.
Yeah, just to expand on that a little bit, the whole reason for the cooperative is that there is the expectation that no one lab is going to have all of the pieces. So a lot of pieces presumably will come from a lot of places to put together the entire system.
Okay, another question on chat is, there's 2 questions. The first is, how important is it to be able to provide both real-time data and collect environmental samples automated that can be analyzed in the lab? I think we're looking for all real-time data. I'm not sure what the last part means, collect environmental samples automated that can be analyzed in the lab. But the first, providing real-time data is important. I'm not quite sure what the end of that question means. Anybody?
I'm guessing that you could take air samples and
later analyze them in the lab.
Later, but this is aimed at real-time.
Yeah, yep.
Can I ask a question to clarify this particular last one?
Sure.
Okay. The idea maybe is a little bit of the both. In other words, you have a sensor that can provide the real-time data, but the certainty of this data is not very high. And basically, if you keep collecting the offline data too, you can later verify that through some sort of antigen analysis or something like that, that what your sensor was saying is actually true.
So it's verifying the results of the real-time data. I think that's fine. I mean, it's validation of the data, so yeah. So the next one is we submitted written questions. Will you be covering those? Those were mainly to give us a heads up of the type of questions we should be expecting, and there's a lot of them, so I don't think we're going to go through all of them. So if you want to ask your most important questions on the call, please feel free. Can you provide some sizing information for the integration center, number of subjects, number of end users, amount of data expected?
That's an open-ended question. It's going to depend on how we fund the centers and how many sensor centers are going to be providing the information. We expect these are going to be big data problems.
Okay, another question on chat is the review criteria in the U54 are market as overall. Does that mean that the overall component will be the primary consideration with lesser consideration of the projects?
No. So what this refers to how that review will be done. So there still will be the review criteria. The overall is the overall score that is based on the significance, the approach, the investigators, et cetera. But what that's referring to is that there will be one set of overall reviews, the overall score, the overall significance, overall approach, et cetera, as opposed to scoring each one of the individual sections. But it's a description of the way the reviewers are going to score the proposal, not so much referring to which parts we think are important.
As a U54, if we have preliminary sensor products, would further development be out of scope and budget? So if there's sensors, wouldn't you be applying to the U01? And we are accepting the development of new sensors and the redesign of existing sensors for this application.
So potentially you could apply to more than one mechanism if you want to do sensors.
Yeah, we've gotten a lot of questions via phone about that, and you can definitely apply to more than one of the RFAs. Will the integration center receive PHI or LDS?
It depends. I mean, we expect that the platform centers will be able to de-identify the data sets that are coming through and before they're sending it forward to the data coordination center, but it will be expected that the data coordination center will run some screens to make sure that the data is anonymous as much as possible. If there's plans to work with the EHR, then it's going to be difficult to de-identify some of those data sets. So the data coordination center should expect that it will see some PHI or LDS.
Okay, next question. We are working on a novel technology that uses sensors for tracking medication compliance of pediatric patients placed on asthma rescue and control medications. These sensors track the administration of asthma medications via aerosols, and the data collected provides an insight into frequency of usage, compliance, and chronological reference for disease exacerbations. This information can be viewed in the context of internal, external, and environmental stressors that precipitate asthma attacks. Such parameters will significantly improve compliance of products and help predict and reduce asthmatic episodes. For RFA EB002, would you entertain a proposal that integrates this important medication compliance aspect of for the PRISMS program? Yes.
Yes, we do. Our goal is to monitor the pediatric environmental exposures, physiological signals, and activities, so we would consider that as an activity, so yes, we would.
Next question, would it be possible to design a sensor that collects both real-time data or periodic collections that could later be analyzed and feed back to the patient? I mean, we're considering real-time data. What does everybody else think?
I mean, if you're collecting real-time data, then periodic data is trivial in that sense. So I don't see an issue here. That's it.
With periodic data?
Because if it's anyway going to collect real-time, periodic by itself comes.
Yes.
Well, but can I?
If you're getting real-time data and you're also getting periodic data that in some way is used to further validate or something, yeah. I think that sounds appropriate. I'm not sure I fully understand the question.
Okay. Next question: how important is it to have the DSCIC focus on FDA approval of devices?
It's not at all important. The main focus is moving towards epidemiological studies downstream, so the consideration of the FDA doesn't play here.
Okay, and from Rosa, if we are applying, that says privately, I know. If we are applying to the U01, does this mean that we shouldn't budget for data coordination? Does this mean that the platform will be built in time to run the pilot studies? Bill has confidence that the platform will be ready.
You'll get two answers to this, but I would say that the pilot studies are going to be of the system. So in terms of actually working them, so you may do some preliminary studies to validate your sensor, but I think it's going to be key for these things that they're going to want to integrate with the platform and integrate with the data sensor, and everybody's going to have to work together to make this whole system work. So my quick answer would be no. I don't think you should anticipate that you're going to be
waiting around.
Yeah.
Okay. Next, to enable a broad spectrum of sensors and personal medical devices to be utilized and accessible to pediatric asthma research, we intend to extend the informatics platform to have a sensor sub-platform, part of the platform that ensures the inclusion of a variety of sensors. Would this be within the scope of the 003?
Yes, if I understand it correctly.
Next is for the DSCIC web portal, what is the level of service expected for the web portal/data store? What is the expected response time to restore the system in the event of failure? What is the expected response time for granting access, answering questions, addressing non-critical issues from the end-user community?
As soon as possible. I mean, we expect 99% uptime if we can get that. And most of the servers that have been running for other software development have been running at 99%, so we expect that kind of response or uptime. And we hope there are no failures, but if there are failures, as soon as possible, obviously, and should not take more than a day to be offline. We expect that you have RAID arrays or something like that, which will allow you to stay online.
Okay, next is a follow-up question to one of the questions we didn't have complete clarity on, and it says, I would like to clarify on my question. They might be non-overlapping data from different categories, continuous data such as sensing of PM 2.5 versus identification of pollen species from periodically collected samples. Many thanks. So in one case it's real time, but different data that's on these particulate matters, and the other is a different measuring something different. Okay, yeah, that will be acceptable. Should the source codes of the software that developed in the Informatics Center be open to public? Some of the client apps can be open, but the data analytical engine may be our own proprietary.
So we prefer that the software codes be open to the public, and if we have some proprietary stuff that is already protected, that's we'll work with you on that and see what can be done.
Okay, next is quick question. Is subcontract allowed under this award? And the answer is yes. So following up on the pilot studies, do we budget to do our own small field pilots, or are we just joining a grand pilot that all groups are collaborating on in year 4? And if so, how do we budget the travel, et cetera, if we don't know where this pilot will be? Well, all of it is a integrated pilot, right?
So you're going to have to budget travel for meetings and getting together. But in terms of the pilot studies, what I would say is that from the sensor point of view, in developing the sensors, you need to do enough piloting to validate that these sensors work. So there's that kind of piloting for the sensors. But in terms of the system, I don't think you need to budget for piloting of a system. And at this point, we don't have specific plans for a grand pilot that would involve all the participants working together in a pilot. Something like that.
I mean, we want the system by the end, but you're saying that the pilot studies on, I'm not quite.
I think that's the next question.
Can you explain a little bit about the importance of the pilot study, evaluation of the sensor of the UO1?
Well, we do expect, preliminary data that shows, that the sensor can work. So that would go along with the importance of the pilot study, if that's what you're calling it.
So, okay, now I have a question. So this whole system, we don't envision that all of the pieces will become a system by the end, and, okay, so that's what I would, you don't call that a pilot?
I think so, pilot.
One day to test it.
Okay, next is, we are applying for the UO1. Part of our investigation will consider human-sensor interaction, i.e., can the patients use the indoor air quality data to change their environment. The in-home info requires visualization of the data. Can we budget to build these, or is then part of the platform RFP, or is that part of the platform RFP?
So that would be a study using this system, and it would be in terms of the presentation and the visualization of the data. That would be part of the platform.
Okay, Chris, quick question. I missed the beginning of the meeting. Can you show the 3 FOA slides again? So these are the 3 FOAs: the sensor development projects for asthma, which are the UO1s, informatics platform technology centers, which are the U54s, and the data and software coordinating and integrating center, which is the U24 mechanism. Yeah, and also I can send out these. Well, no, I don't know who to send them to. We'll make the slides available on our website in the near future. And also, this is being recorded as indicated at the beginning, so it will also be available to listen to again. I'm not sure how long that will take, but we'll get it up as soon as possible, given that there's not much time left before June 1st. Okay. Is there a targeted age group? We did not target an age group. We left it open to pediatrics. Is a preliminary study allowed for the informatics platform?
I would say yes, a preliminary study would be allowed, but again, to validate the use of the platform. I think in terms of the longer-term use of all of this, that would probably be subsequent grants to do.
Is the funds available cited in the RFA for 1 year or for the total of all 4 years? It's for 1 year. Yeah, so multiplied by 4 for the entire project period. Please, would you share your slides with us? Again, we'll post them on the NIBIB website, and we'll also post the recording of this webinar on the website as well. This is a follow-up. So in other words, UO1 applicants should only build sensors, not visualization of data or integration of sensor streams. This is a tough one because we've had a lot of people who have, they have both. So I would say, I don't know, apply to one or the other.
Well, in the RFA, it states that the platforms will be designed for data acquisition from the sensors, integration, processing, visualization, and secure uploading of individual platform results. Ideally, our sensors will be plug and play, and so we do want if you've done that, that shows that, your sensor has the capability of being a plug and play and be able to integrate and process and have the visualization as well. But our sensors, the platforms will be designed for the data acquisition from the sensors.
Yeah, but I think what they're asking is, if somebody has a sensor that's already integrated with the informatics platform as part of the sensor, where should it go? You know, like if the sensor is in a, you know, smart watch that's going to, you know, it has both the informatics platform in it and the sensor part.
Platform. It depends on the expertise they have on their team.
Yeah, but then that review committee won't have the sensor expertise. So that's an interesting question.
So what's the case is one has to respond to the RFPs as written, and part of the reason that we say that is because the reviewers have to review based on the response to the RFP. So, you know, at heart, I think the answer to this question is look carefully at the wording of the RFP, and I think that some of these things could strengthen, that is, having sensors could strengthen the platform if you're applying to the platform side, having some of this visualization software could strengthen the quality of your sensor, but at the end of the day, you're doing one or the other. You're not doing both, because at the end of the day, it's the reviewers that are going to decide the strength of the quality of your proposal, and you've got to respond to a specific RFP.
Yeah, and I have gotten a lot of questions on this because people are doing both. I'm going to ask my CSR colleagues if something came in that was both, you know, both had the informatics and the sensor part. You could add sensor expertise to the review group that could, if it turns out there were a lot of these and they needed to be covered.
I think that both Tiffany and Bill have said things that help in this situation. What Tiffany said is that if somebody has a sensor that has already demonstrated that they can do visualization and be able to upload data to wherever, then they've addressed some of the feasibility that will be used to develop a sensor. Now, we will have a diverse panel for the UL1s, for example, which will include people which have, I think, informatics background, so they can appreciate and evaluate that. But, as Bill mentioned, you really need to look closely at the announcements and the scientific merit of the applications for the UL1 applications will be utilized to evaluate this. So the good news is that if you have a visualization component and include that in the UL1 application, or able to fit it into the space constraints, then that will address some of the feasibility questions. You might have an opportunity to submit both a UL1 and a U54 if the informatics side is sufficiently well fleshed out. So take a look and see what opportunities exist there. But at the end of the day, even though we're going to have a diverse panel, really the special considerations that are outlined in the RFA are what's going to be used to evaluate your application. That said, I have my colleagues here, Mark Ferreira, who's going to be handling the U24. It's not the U54. And Keith Young will be handling the UL1. And do you have anything that you want to add to that?
Let's just see how the applications are, the applications, and then
I want to speak up.
I'll have to wait and see the kinds of applications that come in, and and if need be, bring in mail review. If it's only like 1 or 2 that might have, let's say, some informatics parts that are in the application. So we'll just depend on that.
And we have Peter here. Peter, do you have anything you want to say?
I think to follow on in the comments, just to remember that the applications are going to be evaluated based on the review criteria published in the particular FOAs. And you might want to, again, read those very, very carefully and make a determination about where you think your project or what you're proposing fits best. Maybe it fits best in both. Maybe you submit 2 applications. But if you had to choose one, then you should remember that the reviewers are going to be instructed to review the applications based on the published review criteria.
So just one other point that I want to add. I'm looking at the FOA right now for 002, the U01, and I'm not sure if Tiffany read this, but there are 2 points that I don't think are on your slides, but are very pertinent. The first is preliminary data should be provided in the application that establishes the feasibility of the sensor system, okay? And the second is evidence that important barriers, both technical and non-technical, have been identified, and convincing strategies such as preliminary data to overcome or address them should be included. Well, if you've got a very slick visualization piece, especially if it's something that not only the researcher can use, but maybe the user as well, that might be very important for the panel.
Thank you. Where are we? I think we're on this question, is it okay to budget for existing sensors to test and integrate in the informatics platform piece to give a target population of participants?
Sure. Yes.
Quick question about U54 grant. According to the FOA, the center should include 3 to 6 projects, and the page limit for project component is 6. So the page limit is per project or all projects together?
Per project. So so the center consists of these different components, and each one of those has a 6-page limit.
Is the RFA EB 15003 budget a range of $2.4 million to $4 million over 4 years for the informatics platform piece?
So for 03, I don't know exactly where the $2.4 to $4 million comes from, but the idea, I think, is that there will be $3 million a year. There will be up to $3 million a year for each of 4 years. So that is a total of $12 million, and we anticipate that there will be about 2 awards. So you can do the arithmetic from there and figure out what the size of a given award might be.
Yeah, and the range of sizes is actually in the
range
in the FOA. Yeah. If one of the projects within a multiple project proposal is considered somewhat out of scope and the score is high, would you ask for a proposed modification and budget adjustment? Best and final offer. Maybe.
Yeah. So it's not a contract. So there's no baffle, but we could very well come back and do something like that, depending on what was in the best interest of the government.
Follow-up question to the previous subcontract question. What percentage of the budget is allowed to the subcontract?
I mean, there's no specific limit. Just as a general concept, the majority of the work is typically done at the recipient level, because then it just raises the question of why aren't we making the award to the subcontract if they're doing the majority of the work. That's just a general principle for grants.
Okay, next question is, at GE Global Research Center, we have an electrical impedance spectroscopy / electrical impedance tomography platform. We already have a NIH R01 working on using EIS-EIT to monitor lung function. Would a portable EIS-EIT device for monitoring asthma be under the sensor development project for asthma? And the algorithm for data reconstruction, data interpretation, et cetera, be qualified for the other two FOAs? So the portable device for monitoring asthma would fall under the sensor development project. And wouldn't the algorithm be in the U54s, Bill?
Yeah, I would. So there's contact information in those slides for Tiffany and Vinay and myself. This one I think would land on Tiffany, but I would encourage with a question like this to follow up with the program director and get some additional discussion, because I'm not sure exactly what.
Okay. I guess the tricky part of a U01 is that establishing feasibility of a sensor array necessarily means that we have to have some platform to show that our sensor networks work, i.e. proof of concept. In this case, the platform RFA would assure the scalability of our system, correct?
Yeah, I think so. That basically, like at your sensor level, you're developing proof of concept for your sensor, but the platform is actually building it for the entire platform. So it scales up whatever is being built. That's one way to look at it.
Can you repeat the information about the award dollars? I guess they didn't hear it.
So this is speaking specifically about the award dollars for the informatics platform. There's $3 million a year for 4 years, so there's potentially $12 million available, and we're estimating 2 awards, so that would mean that the total dollars for a given award would be on the order of up to $6 million.
And that's the U54, right, Bill?
And that's the U54. And I don't.
So the total direct cost for over 4 years could be up to $12 million.
These are total. Yeah. What is a reasonable start date for the centers? That is by when awards can be made. So all awards are going to be made by the end of, no later than the end of September, which is the end of our fiscal year. And just to reiterate, all 4 years will be paid in this September 2015, which is not a usual practice of NIH. We usually fund on a yearly basis. What is the reasonable start date for the center? Oh, is that the one I just read? No, I guess it's the same. Yeah, that's the one I just read. Is a physical instrument a deliverable? Yes. Could a health outcome analysis be part of the sensor development? Not sure.
It would depend on what you mean by a health outcome analysis. For the sensor FOA, this is for the development of wearable and non-wearable sensors that can monitor pediatric environmental exposures, physiological signals, activity, and or behavior in natural environment to gain new insights. So that's what's under the sensors FOA.
Yeah, and also, I mean, what we're looking for in this initiative is a research tool for epidemiological studies. We're not looking for, how does this work in a clinical application, which eventually we hope to get to, but that's not the end goal of this particular program. Presume that funds for sensors to be used in a pilot study are part of a U54 as part of a U54 is suitable. Is that correct?
Yes.
Then to verify, if budget is over $500K per year on RFA 003, is special approval required? No, because it's an RFA. Usually you have to get approval for applications over $500K, but not for RFAs. Got it, thanks, good. Can you paint at least a sketch of the collaboration you anticipate between awardees on the U01, U54, and U24? For example, how much interaction would be anticipated between awardees of the U01 and the informatics platform awardees, and at what points in time? So we expect a very close working relationship between all three of the awardees from the awardees from all three of the initiatives, and we anticipate at the start of the program we will have a grantees meeting to further plan how all of this is going to work. And we also, I forget exactly the frequency, but it's in the FOAs, the frequency at which we will have yearly meetings and also conference calls. So it will be definitely a team effort. Could the sensor development be associated with current commercial sensor systems like Propeller Health? We are planning to develop exposure sensors to be associated with rescue inhaler usage in space and time through Propeller sensors. Be associated with. So you're developing a new sensor that can work together with other already developed sensors, I think is the question, right? I would say yes. I mean, the funding that you get will be to develop the new sensor and integrate it with the commercial sensors.
Yes, for the sensors newly developed, existing, or redesigned. So.
Yeah, so
and getting it to plug and play with the informatics platform.
And making it fit and plug and play with the informatics platform with existing. Yeah, I think all of those things would be possible.
For the DSCIC, under cooperative agreement terms and conditions, notes that a responsibility of the PIs, PDs is providing goals and milestones or objectives at the time of award. Are specific timelines also expected in the application? If so, will there be an opportunity to update them in consultation with the other participants immediately after the time of the award?
Yes, it'd be nice to have a timeline, and then you can obviously, once the funding is done, then we can talk about it and adjust it accordingly. So those are flexible.
I heard that maximum number of pages allowed is 6. However, it seems U01 has a 12-page limit. The 6 pages is for the U50
projects within
the U54.
It's a part of the U54.
The
12 pages for the U01 and
12 pages for the U24. Can you provide details of award information for sensors RFA 15002? Similar to those explained for RFA 15004. Details, I'm not sure what.
How much for how long?
Oh, okay. So the awards are 4 years. It's actually, we gave the total amount of $2.5 million. So we were envisioning 6 awards altogether will be made. that could change. And the total amount is 2.5 million total costs in a year. So, something like 500K total costs for each UO1 award.
Each year.
Each year, yeah. Do IRBs, if any, need to be filed and pending before we submit the application? The resounding answer is no. Some consultants are engineers who do not typically have an NIH kind of bio sketch. How do we go about including their bios into the proposal? They need to use the bio sketch form that is for NIH grant applications.
Just go back to the previous question about do IRBs need to
filed and
write the application, and we said no. Just one request: be sure to address any human subjects protections and risks thoroughly before you submit, because that's part of the scoring consideration.
Right, and if the IRB approval is still pending at the time of award, then there will be restrictions made on the use of human subjects until the IRB does approve. And then we can just lift the restriction. Furthermore, is the 12 million cap for 003 just for direct costs?
Total cost.
I have a question regarding the U54. Without the a priori collection of data from the U01 arm or anticipation of the exact types of data, would there be any guidelines for the actual informatics platform development?
So the quick answer, that's the responsibility of the offerer to make those judgments, and probably part of the evaluation of the proposal of the U54 would be how well you're able to anticipate what the requirements of the sensors would be.
And the next question, could we develop multiple wearable sensors with each one measuring 1 to 2 pollutants that are markers of asthma exacerbation? I don't know if everyone heard that. The answer is yes. To verify, 12 million of RFA 003 is total direct and indirect? Yes, to verify, the answer is yes. We've come to the end of the questions on chat. Does anybody want to write in additional questions? We can wait a minute, or you can ask your questions via the phone if you don't feel like writing.
Yeah, this is Tom Peterson. I have one point again I want to make. We haven't talked about data security, but that will be an important human subject consideration for all the RFAs.
So while you're thinking, if you've got any questions, just a reminder that children, not by parents, but children by the NIH are defined as being people under the age of 21. So that's the pediatric population that we're talking about.
And also, after this webinar, you're still feel free to contact the program contacts, grants management contacts, or review contacts on the initiatives. They're listed. All of the contact information is there, and we'll continue to take questions as long as you have them. Okay, we got some more questions.
Admin reduction for for these? Okay.
Are HCI studies acceptable for the U01 as to iterate on the wearable sensor affordances, preferences by pediatric patients? Is HCI human, not sure what HCI is.
Human-computer interaction.
Oh.
Right there. Human-computer interaction.
Oh, so are human-computer interaction studies acceptable for the U01?
Showing if a patient
can operate.
Can work it.
Yeah. I would think so.
Why not?
I mean, we want the sensor readout to be useful to the patient. So the answer is yes. Is a product like Trip Planner to assist asthma patients avoid high areas of air pollution part of the visualization tool?
I don't know that it would be part of the visual. I was picturing the visualization tool being software to present a wide variety of data to the individual. And so presumably Trip Plan, although I don't really know Trip Planner, but presumably Trip Planner, if it tells you how to travel to avoid, could be integrated into that. But it's not really part of the visualization tool.
Do we need to find collaborators from academia and industry to apply to these 3 FOAs? No, you need to find the right collaborators for what you're proposing to do, regardless of whether they are located in academia or industry. Would it be possible to share the specific aims with the program contact to have feedback? Absolutely. Trip Planner means a planner on mobile applications. Not sure I don't know, I guess we're not familiar with it. So
that's what the functionality of Trip Planner is.
The sensors can be used at both hospitals and homes, right?
Yes.
The idea is if the child doesn't, this continues. The idea is if the child doesn't like the way the sensor looks, she won't wear it. So my question is if we could plan various user studies over the 4-year period. I would say that's actually really important in the design of the sensors. Or there is a preference aiming at home use. Yeah. Over hospital use. I mean, I guess we're picturing this in the patient's in the asthmatic child's natural environment. So I would say that it's more not just home, but wherever they're going, especially if they're wearable sensors. I guess they would be okay in a hospital setting, but that is.
But only in a hospital, I don't think would do it. I mean, the intent of the mobile is to be able to monitor the environment wherever the environment.
Right, during their everyday activities and things like that. I have a question on U01. I heard the information platform is likely to be a smartphone, and the sensor data should be transmitted to the smartphone. Should we also consider scenarios when users have the wearable sensors but forget to bring smartphones with them? And the platform doesn't have to be a smartphone.
But so
You want?
So this is a design question for the sensor that would address, you know, the breadth of usability of the sensor. And I mean, I think certainly given the choice, you would rather have a sensor that would continue to collect data even if the person forgot the smartphone, to bring the smartphone with them. But there's not a right or a wrong answer to this question, I don't think. I think it's really more, though, it's something that would come out in the review of how well designed is your sensor for these applications.
Okay, this is a similar question to a few before. I'm a little bit confused on the distinction between the U01 and the U54. Our sensor requires data analytics to give meaningful results. Can software development be included as part of the U01? Yes. Okay, we'll wait a couple of minutes if people want to write some more questions on the chat, or if you want to chime in via the phone. I have an interesting question here that's different than any that we've heard so far that came in by email, so I'll read that. Can you provide clarification on how external databases not related to exposure, activity, or other data collected by PRISMS sensors would be logically connected to the PRISMS data? For example, would the connection come from additional study data uploaded by an investigator?
So that could be one answer. The other way it could be done is, like, if you get something for a particular patient population and that patient population has had some data acquired for other purposes, like, for example, if that imaging data done on them, then you could tie those two data sets together. So you could provide either link outs to other data sets or provide a way that people can compute on that data with this new data that you're getting.
Okay, and a new question online. So U54 pilots need to be using existing sensors, perhaps in novel configurations?
Well, I'm not sure I understand that question. I would say not necessarily. The U54 pilots, I don't think are going to happen in the first year, and I think by the time the U54 pilots are ready, hopefully there will be some sensors ready as well. And in my mind, the U54 pilots would happen when there is this community of sensors that could go with them. But it goes back to the notion that over the 4 years of these awards, there is going to be a lot of interaction among all of the grantees.
And also, you know, we're allowing not just the development of new sensors, but the redesign of existing sensors. So some sensors could be ready to work with the informatics platform pretty quickly. Again, we're out of questions online, so we'll just wait a few more minutes to see if anybody has any remaining questions. Okay, it looks like we're not seeing any more questions. Anybody here have any parting words of wisdom?
Wisdom, that's words until you added that.
Write a very focused, clear application. Make sure that, well written and clear, so that the entire group of reviewers can understand it. There's nothing they like less than reading an application that isn't well written. Okay, we have one more question here. Suppose we have a pilot with 50 children, each sensor package at 3K. Is that okay? Each sensor. Not sure what that means. So they're saying 150K? Yeah, so pilot of 50 children, each sensor package at 3K, is that okay? So the budget, the total cost for a U01, we're picturing at around 500K. I don't know if that answers that question or not.
Yeah. So the rest of the answer to that, I'm not sure. So again, I would encourage you to call one of the program staff and expand that question a little bit, and there may be some better clarification that would follow a discussion.
So multiple sensors used together for the U54. I don't know what that means. So, I mean, if you have an array of sensors rather than a single sensor, that's great. I don't know that, I mean, the sensor development would be in the U01. I'm not quite sure why the U54 is being referred to there. Okay, it goes. Anybody guess what that means? Okay, then we'll go on to the next question. And David, if you want to clarify that, we'd be happy to try to answer. Next question is, do you have a definite definition of the size of a wearable sensor?
We do not have a definite definition of the size of the wearable sensor.
But considering it's a pediatric population and you want them to actually wear it, you can kind of imagine what it would need to look like and how big it would be and how heavy it would be and all of those considerations. Because it could be anything from, it could be a sensor on a watch, a sensor on a necklace. It could be sensors in sweaters, or I mean, the sweater would be large, but kids wear sweaters, so it wouldn't, so it shouldn't be an imposition than something that they're not going to wear versus a watch, which is very small, but also easy for a child to wear.
The Captain America shield, backpack, type thing.
I don't know, David, if we answered your question or if you could a sensor on back of a backpack? Yes. Kids love backpacks.
Another question.
Okay. As for the wearable part of the U01, what is required to demonstrate that the sensor is wearable? Do we need to get a designer for ergonomics if it is a watch, or the core sensor development is the focus? I mean, I think it's a good idea to get, you know, I don't know where the feedback comes from. Maybe it's an ergonomics person, or maybe it's the kids themselves as far to find out. I mean, you don't want to design something that kids are not going to wear. So whatever expertise you need to determine what is acceptable to a child would be, you know, you should try to pursue. You're welcome, Jason. Yes. Can it be a tattoo-like sensor?
Yes, it is.
That would be very in these days. So we'll keep waiting a little while because it seems like the questions are still coming in at a somewhat of a good clip.
That was the magic comment, Chris.
What, to stop it? Okay, we'll wait 2 minutes and then wrap up. So type fast. How many pages are you expecting a U01 proposal to be?
12 pages.
So the U01 and the U24 have 12-page limits. Should the designer's cost, as you mentioned before, be included in the U01, or would that be considered as unnecessary cost? I think it's a really important thing to include, so I would say it definitely could be part of the budget, as long as they're not designing your own clothes.
That's interesting. Would that be like consultant costs?
Human factors, kids, yeah. So,
RFA 003, admin core section, is 6 pages for research plan, research strategy, correct?
yes.
But is the support or not part of the overall page limit, 12 pages? Separate section.
Did everyone hear that? The question was, are letters of support part of the overall page limit of 12 pages in its research strategy? And the answer is no. That is the overall section. Oh, that's part of the other.
So the R03, and again, check the announcement to get the details exactly right. But to a first approximation, there even better than to a first approximation. Check the announcement to get the details right. There's an overall piece, which is 12 pages. There's an administrative core, which is explaining what your secretary is going to do. I don't know exactly why you'd need, it's a little bit more than that, which is 6 pages. And then there are the projects. So the projects could be the data visualization, a project could be the interface with sensors, a project could be communication with the web. Each of those projects has 6 pages available to it. So that's the layout there.
Okay, questions going once, going twice? Okay, I think that's it. We thank you all for joining the webinar, and again, if you have additional questions, contact the contact program directors on the RFAs, and we hope to send in some really exciting, strong applications. We're really excited about this program ourselves, so we're looking forward to seeing what you submit and to funding the program and 4 more years. Okay, thank you, everyone.